There is a bit of a old wives' tale about potency and the equivalence with Botox and Xeomin. So it started, unfortunately, because there was a paper come out, Hunt and Clark paper back in 2009, I think it was, where they got the whole, and all companies do this, right? When they know there's something coming out around the corner, they try and somehow get hold of a vial and test it, right? And see what the hell are we going to have to compete against.
And I think that's one of the challenges for a lot of providers or injectors out there is that, especially in Australia, where, Botox was the only only product in the market for a very long time. And people became very accustomed to, as you said, dilutions and injecting techniques. And now all the other products that have come onto the market, particularly now with Xeomin, that has some unusual nuances about it, people are always comparing it to Botox and what they need to do to get an equivalent dose to Botox. And it seems to be a little bit of a mental hurdle, or potentially it could also give people the impression that it's not as good as Botox because you need to make more units, or you need to use a slightly different dilution, and people are sort of always comparing it. Do you think that that's, a real issue? And do you think it's just a process of re-educating people into thinking about it as each product on its own individual merits, rather than comparing it to like the gold standard or the dominant brand in the marketplace?
Look, there's no problem comparing it to the Allergan Botox because it's a good product, right?
Yeah, of course.
It's a very, very good product. It's been around for a long time and it's fabulous. But as you said, there are nuances with the new ones coming on. And there is a bit of a old wives' tale about potency and the equivalence with Botox and Xeomin. So it started, unfortunately, because there was a paper come out, Hunt and Clark paper back in 2009, I think it was, where they got the whole, and all companies do this, right? When they know there's something coming out around the corner, they try and somehow get hold of a vial and test it, right? And see what the hell are we going to have to compete against. I mean, to be honest, it's such a growing market, they don't have to compete, but
yep.
They see what's coming. So Allergan got a vial of Xeomin and they put it on the Allergan assays. Now, the assays are different and they have to be different because they're manufactured differently. So the way you prepare and treat and get it. And what happened was that they ended up with 20% lower, what appeared to be a 20% lower potency compared to what they normally would expect to see with the Allergan products, where they didn't put both of them and test them against each other at the same time. They only took the Xeomin and they used the wrong assay and excipients to do it that you wouldn't normally do. So that was problem number one. And then, so following that, Moaz Karpi did a study where they looked at treating a glabella and they just took, based on that, they said, well, okay, let's just put 30 units on one side and in one patient and 20 units on another and see. And they were both the same. Now, the conclusion was, well, 20 units, 30 units, they're both as good, but it doesn't say one is better or that you need more than the other, all right? Because they both worked. And so this was questions. And then Wilf Prager, he turned it around and just switched the doses around. So he had 30 of Botox to 20 Xeomin and the outcomes were exactly the same. Mm-hmm. And so there's a lot of studies. There's a fantastic one by Michael Caine, who did a lot of the Botox work, and he did a really good randomized double-blind study on Botox versus Xeomin head-to-head on glabellas, and there was no difference. And it was a big study, and it was really well done. So that sort of says there's probably differences in technique and nuance, but really basically the potency is one-to-one mix. But unfortunately, a lot of people, I think, also got a bit caught out with the forehead, because I think clinically there is a different precision. You have to inject and think, I have to get the drug where those motor end plates are. Mm. And with a precise drug, you have to be precise on that. So either you've got to spread it more, which you can increase your dilution, or you do a few more injection points.
Okay, so I just wanted to touch back to your dilution. So in a 100-unit vial, you're doing 2.5 mils of saline, did you say?
That's okay. So I actually do 2 because that's how I was trained. And, yes, it's hard to teach an old dog new tricks. But in fact, the Merck's recommendation are 2.5 mils dilution. Okay. Now, to be honest, it doesn't matter. It's the number of units getting to where they're needed is what the important thing is.
Yeah. So not that we want to compare drugs because we've said very clearly they're just different, manufactured different processes, etc. But that does make it nice and easy if you've learned on Botox. Basically the same thing in terms of dilution and
absolutely. And that's what I tell people when they're converting. Just do exactly the same as you do with your Botox.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.